Good morning, everyone. We'll get this meeting started. I'd like to start by acknowledging that the TNRD, that we connect with many First Nation communities across this vast regional district. And today we are located on Tecumseh-Secwepemc territory, situated with the unceded ancestral lands of the Secwepemc Nation. The TNRD appreciates the partnership that we have with the Tecumseh-Secwepemc and respect the territory and land on which we gather today. I would also like to acknowledge that we have a couple of directors that are joining online. We have Director Birch Jones, Director DeMar, and Director Simpson. Are there any additions, deletions from the agenda? Okay, we got someone to adopt. All in favor? Or sorry, I need a motion. All right, Director Smith, second by Director Thorpe. All in favor? Thank you. We'll move into the minutes from the last meeting.
Move the minutes.
Moved by Councillor Bass, second by Councillor Middleton, Director Middleton. All in favor? Opposed, if any? Seeing none, thank you. We'll move right into delegations, and I'm very excited to have the CEO of the Royal Inland Hospital Foundation. Also joining will be the Chief of Staff for Royal Inland Hospital, Dr. Liz Parfait. And correct me if I'm wrong when you come up here. I'll leave that. I know there's a lot more credentials behind both of your names, but I will have you come up and speak and address the board. Thank you.
Hello, everyone. Thanks for inviting us to come. I know I was here recently, but now I can't remember why. You know, on behalf of the foundation, I'm here just to talk about the recruitment that we're doing with the help of the funds that this board gives us. And I asked Denise Newton in my office just to go back to the beginning, and she said that from April 1st, 2019 to June 30th, 2023. So she said that we've spent your money, $32,858 over those years. And I know it's about $30,000 that you agree upon every year. So I know up till now for 2023, it's about $6,800. And what do we use that money for is we use it to do baskets that we put in the doctors' hotels or in R4 accommodations. If there's any whitewater rafting or touring around, cars that they rent, anything that we can do to show them the whole region and help recruit them here. And we have lovely anecdotal messages that we get back, like the hospitality here has been unbelievable. Thank you for the ski tickets up at Sun Peaks. Thank you for that beautiful tour that we had when they went up to Wells Gray. So people are telling two friends and so on, and we are getting a lot of locums coming to Kamloops. We at the foundation rent two accommodations. We have a condo at 227 Battle and an apartment at 1320 6th Avenue. Plus, we received very generously, a house was donated to the Hospital Foundation at 38 Clark. It was $1 million donation from a donor. And so in that house now, we house 4 students from medical school at UBCO. They were having a very hard time doing their clerkship here because they could not find rent in Kamloops. They told me about stories about basement suites for $2,700 on the North Shore. And so the head of the school called the foundation and said, can you please help find these 4 students a place to stay? Otherwise, they would not be able to do their clerkship. And they do travel to Barrier, and they're in Bonaparte and other areas. So I've got all 4 of them into the house because the house has many suites, and they're at a very undervalued rate because we want to educate them. And as well, we have one floor that we rent to UBC Vancouver for a resident to come here every month. It's a different resident. And then the 4th unit, because there are 4 units, we keep that open for a locum coming where we charge, you know, around maybe $50 a night, which is under the $150 amount that IH allots locums, but we're not using the $150, we're just charging them $50. So all this to say, we have a lot of people coming. We have a Google Calendar that's got all kinds of colors and dates of people coming. We have people coming with their dogs. We have people coming with their children. We have discussions with school boards to see if they can get their kids into school. My office at the foundation has taken on finding people jobs, spouses jobs. I have a OBGYN doctor that's coming with his husband is looking for a firefighting position. So I have to reach out to our firefighters and see if they have a hire. So we're really busy at the foundation raising money and recruiting. And so I do have a list here of, that I can share with you or email it that talks about the many different doctors that have been here, what specialty and who we've hired. And it's looking good. I don't know if, and I really do depend on the money that we get from you. We use it, we send in the receipts, we speak with Scott, we go over things, of course, there's no alcohol involved, and we really appreciate it and need it. So thank you for working with us. I just have one little anecdotal story I wanted to talk about in Ashcroft. I got a call from a nursing agency that said they had a nurse that wanted to work in the Ashcroft hospital there, but could not find a place to stay. And then I ended up speaking to the mayor of Ashcroft, and they pointed me to a company from Abbotsford that had just bought an apartment building and was charging a tremendous amount of money for this room. I think it was like $4,000 a month for this apartment. And I asked them if they could lower it so that Ashcroft could have a nurse stay there potentially too. And they were great, and they really appreciated the call, and they did lower it so that we could get a nurse there. So all kinds of things come across my desk and all kinds of conversations, but it's always to make sure we can get the health professionals we need in the region to help the community. So you might have some questions for me, but I would like Dr. Parfit to talk as well.
Sure. Hi, everybody. My name is Liz Parfit. I'm an infectious disease specialist, and I also did general internal medicine for a few years when I first came here. So I've been in Kamloops since January 1st, 2015. I started in an administrative role as well about 3 years ago as the site medical director, which is kind of like the vice principal with Todd Ring in the principal's chair. And the reason that I got into this part of medicine, which I never would have dreamed was really because of my interest in physician recruitment. So before I was in these roles, I was working with Heidi as we created a position called recruitment ambassador. So I've been really very engaged on the people end, like the Heidi, like where Heidi really shines is that people end, really making very personal connections to people and finding out how to support their families coming to Kamloops, not just the practitioner. So now I'm in the chief of staff role since on an interim basis for almost a year now, and then in the permanent position since June. So I just wanted to give my background for how I came to be here. And I'm not exactly sure what you want to hear from me, but I'm really looking forward to your questions.
Thank you for your time, and just for the board's awareness is that the hope and the plan is to have the Royal Inland Hospital Foundation and whoever we need to come and present on every 9 to 12 months. And so to hear from the board what we might want to hear at future presentations, and then they'll be able to do up a presentation for us. But just to dive into what we want to hear. So first on the speakers list is Councillor Director Newstater.
Thank you through the chair. Thank you for your presentation and for being here today. We're so grateful for the work that you do, and just recognizing how competitive it is out there and how thin the resourcing is. And I think this is a great use of our funds. So thank you for the work that you do. I'm curious, and it doesn't need to be a scientific methodology. I'm sure you don't have it in front of you. So your best, anecdotal. What does the conversion rate look like between the number of doctors that we entertain and bring into our community and try and demonstrate the value of coming here to do their work, and how many actually do sign on and make Kamloops their home and their place of work?
I can probably answer. That's a fantastic question, and it really depends on the specialty we're talking about. And so there's a supply-demand issue that's different within each medical subspecialty. I would say my my gestalt on this is that once we get our talents on people, we actually have a pretty good conversion rate. And where we're trying to work more is that upstream end with the health authority and health match PC and that whole kind of advertising piece. But I feel that we have a pretty good rate of conversion once we connect with people, because I don't want to like, I don't want to say anything bad about Kamloops because I love this place so much, but it doesn't always have the best curb appeal. Once we can get people here, they see it as like a hidden gem. That's my own personal experience. I did high school in Vernon, so I had my own conceptions about Kamloops, but once I got here, I completely love the place, have no plans of going anywhere else. So I think our conversion rate is good. We need to do more work on the upstream end, and then there's specialty specific factors. Like, for example, we're really struggling with neurology, OBGYN, but some of the reasons for that are outside of our control, has to do with how many people are training in those specialties, staying in larger cities, hyper specialization. You know, you're a neurologist, but you're actually an MS specialist, and you're not sure if you want to do general neurology. So there's some factors that are outside of our control.
I just want to keep the anecdotal for a minute. Back to the neurologists. So we've had a few strikeouts with team neurology because we put together a group to try and get neurologists here. And then we found out about a doctor, Dr. Jeff Poon, who's an orthopedic surgeon, and his wife, Robin Bessemer, is a neurologist. So we did the big love. We got Jeff here. We hired him. They bought a house on Nicola, and we know that she's coming. She's doing her fellowship in Vancouver, but she'll be here in less than a year. And so now we have the neurologist, but we're trying to still make sure Jeff is happy because, you know, if he's not happy in his position, they might, you know, what would keep them here. So he's loving it here so much that he's now gone back to Western, to some of his friends at Western University, and he's telling them about Kamloops. And we've had a pathologist check us out and an anesthesiologist. So, you know, when you show the love to the doctors, they're spreading it because there's all kinds of hierarchy and all kinds of administration difficulties in certain hospitals. And we're trying to lighten that load and saying, what will it take to bring you here? So can you design something? So I've spoke to an anesthesiologist the other day, took him out for dinner, and he's coming with his family and 4 kids, and he just has a few requirements because he has a special needs child. And I said, well, write them down and we'll put that, you know, put it in your contract. He was funny. He said, you know, they never teach us that at medical school, anything about financials and how to negotiate a good contract. And I said to them, remember, you're only as good before you sign. So if you need something here, put it down on paper.
Supplemental.
Thank you. Yes, supplemental. I did have a second question, but I think you answered it very well already, which is what we can do. And I think that's fair comment on Kamloops. We hear that perception over and over that until people live here, they don't realize how much they'll love it. But just as a piece of encouragement, our Build Kamloops work that we're doing right now will hopefully help you in that endeavor as well. So thank you for the fair comment, and we'll certainly take it back with us. Thanks for the work you're doing.
Yeah, and keep the foundation involved in what's doing with the Build Kamloops. I hear about it, and I read it, but that would be good for us to be involved for the doctors we're trying to recruit.
Thank you. Director Roden.
Roden? Okay. It's all right. Sometimes I forget. Sometimes I forget too. Thank you, Ms. Coleman, for bringing up the Ashcroft situation, because something we hear in our community, and I'm sure other communities in the health district are the same. Royal Inland Hospitals in Kamloops. We're in Clearwater, Lytton, Ashcroft, Barrier, Chase. And it's a reminder that Royal Inland Hospital and the foundation do so much for our communities. I don't think there's any one of us, no matter where we live in the TNRD, who does not know someone who has benefited from Royal Inland Hospital. It's our hospital as much as it is the people of Kamloops. And so when Heidi phoned me and said, hey, we're desperate for someone to live who wants to come to Ashcroft Hospital, and the foundation can help out with that. That was just awesome to see that in our community in Ashcroft, helping out, you know, people not just in Ashcroft, but again, Lytton, Spence's Bridge, Cache Creek, Clinton, Ashcroft, Wallachine, who all use that facility. So I just wanted to say thank you for being truly thinking locally and acting globally. I don't know, does that make sense?
Thank you.
Yeah, all the nursing agencies. As a matter of fact, just something else that I wanted to say that the foundation, with your help, would do, that I've spoken to all the nursing agencies, and if for some reason a nurse will go only to, let's say, Clearwater or Ashcroft, but would like to have the use of a car so that they could tour around, that we will pay for that car is as a carrot to lure them there, and that's worked out well as well.
Thank you. And I definitely didn't forget your name. The mic shut off while I was talking. So just for clarification, we've got
Thank you.
Director Blackwell.
Yes, nice to meet you both, especially Dr. Parfit in person versus Twitter for many years. There you go. Yeah, I really like the fact that you're working on placemaking for families and for doctors and nurses and health professionals in the community. And in Clearwater, we found that incredibly important. Also, the real shift with Interior Health and with partners on supplying housing as a landing place for these professionals, in even in communities like Kamloops, where you think there'd be lots of availability, but cost is a barrier. The one thing that I haven't really understood, especially with doctors and doctor recruits, I always assumed that the complexities of running a business, their own basic business, was a hindrance to the new generation of doctors versus the other ones. But, you know, in Clearwater, we're finding it that they actually want to run their business. So what are you finding as far as that sort of mix of supports needed for doctors to, you know, just do the doctor part versus running their small business? What's your feelings on that environment?
Yeah, I can definitely comment on that. I just want to be clear that all of my experience really pertains to the hospital-based physician community. So I can't speak for community family physicians, and that would be under the divisions. But I still do think the majority of trainees coming out of medical school and training are not all that interested in the business aspect. And so structurally, we are gradually changing the way that we define work and pay for physician work in different programs, so that it's not so much about running a business and keeping over that overhead, and looking at actually how do we actually take care of patients better and use our time the most meaningfully. So I do expect that that's a shift that will stay. It might not fit with your experience, but it may be because you're also bringing in physicians that are internationally trained and have, there might be other factors at play, but within that kind of Canadian trained cohort, hospital associated, there's a lot of interest in not needing to run a business. Yeah.
I just want to add to that about in Kamloops, if people with GPs. So I'm on the board of STEPS, which has a clinic here in Kamloops and up at Sun Peaks. And then we're opening a third one on the North Shore. And there the doctors, these are all family practice doctors. They do really enjoy the fact that the STEPS administration does all their billing, and they don't have to deal with broken toilets and any problems. And I do hear from the doctors there that they have never done so much clinical work in their lives, and have just been dealing so much with patients and not having to deal with other stuff. And I just wanted to say something about Clearwater. It was Carol Fenton, our public health, connected with me to help you get your doctor up there for the, now I can't forget his name, but he's from Quebec, the public health doctor that moved there. And I contacted someone, a real estate agent up in Clearwater, and she ended up renting them her house. So really, it's just getting on the horn, calling, being one family, being together. And I think he's arrived and living there.
Yeah, actually, we're at a full complement of doctors for a small town, which is, yes, it still needs 7 nurses. So, but we're promoting that today. Thank you.
Thank you. Director Getz.
So here comes the guy that throws cold water on the party here. 18 times in 1 year, probably 20 before we're done. Now, we're part of the 7.5 million that Minister Dix rolled out. Still haven't seen what that's going to look like, but it doesn't help us. It helps us with nurse retention. We need some help to convince him that we need nurse retention. Incentivization for nurses, I think, is a bad idea. We close because our nurses decide to go somewhere else for the weekend and get better pay. So we're trying to play that game as well. But I believe that if we're handing out all of these things to nurses and doctors, we need some return on investment. We need at least a 2-year, I'm gonna be here for 2 years, I'm gonna be here for 3 years. I think forgivable loans and all the rest of that and being headhunted to the States in the 3rd year is unacceptable. And I think that's where some things need to be changed. So Royal Inland Hospital is a great hospital. It's not my hospital. Nicola Valley Memorial is my hospital, and I expect it to be open. And we have offered a lodging at our cost to show you that we're serious. And I have not been taken up on that one single time. And to say that I'm unhappy with the whole situation is an understatement. So don't mean to rain on the parade, but that's where it is.
Yeah, I think that's understandable and well-deserved. This is definitely not all a good news story, right? One thing I will mention is I think that many of our emergency physicians are coming to staff your emergency physician, sorry, your department. So we definitely see ourselves not as an island, but we are the hospital, the tertiary site that's serving all these communities. And we do want to be able to almost overhire, recognizing we don't want to pull away from other communities in need, but in certain areas, if we can hire up so that we can provide that outreach support to communities in need, that's something that we, want to do.
Yeah, and talking with Selena Laurie, Dr. Selena Laurie, if we did ever put something out there with the divisions about forgiving loans for GPs, we would say to them, it's got to be a 10-year commitment and you have to do longitudinal healthcare practice, not necessarily become a hospitalist in the hospital. And so that's something the foundation is talking to the divisions about. So that would be GPs. That's not necessarily going to help the hospital. But anytime we get a call for someone in Merritt, and I think we did provide a car for someone that was going to go, it's on our radar. We're all watching the news. We know what's going on. So thank you. Thank you.
I'll just add, there are, of course, the return of service programs through the ministry. So I think that's maybe what you're referring to after they would do their 3 years and then they leave. And I think that's why we have this small window to really integrate people into the community. And there are communities where that's working well. And I know there are other challenges because sometimes it's just not realistic that they're going to stay. Like I know there's a physician in one of the communities represented here who's just married someone from the Lower Mainland with a job that's not going to be able to move to one of those communities. So we do what we can to integrate that community connection.
Supplemental Director Getz.
The return of service for 3 years has been rejected, just so you know. Now we're trying for 2. So the nurses have said no. So again, that's not your bailiwick, it's somebody else's that they need to maybe use a little bit of a hammer. So thank you.
Have Director Smith.
Thank you, Chair, and thank you very much for coming out today and being with us to tell us a little bit more about the situation that we're all in. My question is, how many physicians are we actually short in the region? Just for a question, thank you.
So that's a really interesting question because I could give you a more specific idea within specific programs. For example, we have, we're supposed to have 6 full-time neurologists at Royal Inland Hospital and we have 0 right now. So we are completely relying on locums coming in and we're relying on our colleagues at Kelowna General Hospital who have been incredibly generous to support our site through this. We don't necessarily have perfect definitions of how many physicians we need to have in each, in each specialty. So I might have to come back to you with a better guess of how many unfilled positions we had looking globally at all of our several hundreds of physicians that are hospital associated. But if you have any questions about specific programs, I could answer that better.
Yeah, and in the groups we have, when you don't sleep at night, which happens often because she's worried that potentially women are going to give birth in Kelowna, but I think we've fixed that. You talk about anesthesia, neurology, OBGYN, and pathology and psychiatry as the big ones. I think that's what we're focusing on, but doesn't mean that everything else is good, but those are the ones that are high risk. So.
Thank you. Director Stamer.
Thanks, Mr. Chair. So I'm not sure, you're probably aware that many of our residents are having trouble with Ozempic as a prescription drug. And it was just brought to my attention on Monday, but I'd like to know what we can do through IH and also through the government, because it came to my attention that the replacement drug that people are looking for, a lot of these people don't have a doctor, or they may not have a doctor now. So now there has to be a new prescription for this drug to replace the drug that they're using now, because a lot of people are using this drug for other uses, including weight loss. What can we do in the short term to try to get this back on track so that not only are we inconveniencing our residents by trying to find a doctor and get a prescription for something that they shouldn't even have to in the first place, and making sure that those costs that are associated with that drug are able to be, transferred over, similar to what Ozempic is. What can Ontario Health do about this?
I don't actually have a lot of information for you on that specific issue, but I can bring it to the Pharmacy and Therapeutics Committee within Interior Health. That's the portion that we control in terms of pharmaceuticals. I haven't seen any shortage notices within our hospital in terms of patients that are in our care, but I'm not a prescriber of Ozempic, so I don't have the information that you need to answer that question.
Supplemental.
Thanks, Mr. Chair. Yeah, well, I mean, it's a serious impact. I mean, in Barrier, you can't get Ozempic anymore. There's pharmacies in Kamloops that have it on a limited supply, but they don't want to give it out because they've already got existing, patients, and they want to be able to, maintain that customer base. I'm just wondering what we can do as a board to try to get the government to, it should be pretty simple. I mean, if there's another drug that's available, there shouldn't be it should be fairly seamless between the pharmacies and the doctors. We shouldn't have to try to go all the way back to the front of the line to try to find a doctor to fill a prescription that you already have.
Thank you. Director Hamer Jackson.
Yeah, I'm just wondering now, you said neurologists, is there a lot of neurologists in Kelowna or other specific experts? And yeah, sorry.
Yeah, thanks. So Kelowna does have a good contingent of neurologists, but they are relatively short, actually, considering the population that they serve. And in a lot of our specialties, like even, for example, when I'm on call, I cover the whole health authority at times. So there's a lot of cross coverage that we do. But yes, Kelowna has more neurologists than us, but they are relatively short. And in fact, we are supportive of further hiring to Kelowna because they're helping to continue services going for us. But there's a relative shortage of neurologists in the entire health authority.
Okay, thank you.
Thank you. Director Birch Jones online.
Thank you. Thank you for your report. And certainly, I know in Lillooet, I'm area B, which is around Lillooet, we've done made some efforts to provide housing for the RCMP, and it's really made a difference. So I'm really listening to you talk about the housing assistance you've provided to doctors and nurses, and it's impressive. And thank you for that. And I think it does work. I also like that when you were saying that you were considering Royal Inland to be a base to provide some outreach and some services, for example, doctors to Merit. And we really appreciate the visiting specialists coming from Kamloops to Lillooet Hospital. And so I just wanted to put a plug in for that. And also to remind you that we do have a surgical suite there, which has been operational, but it's there. And this board has spent over the last 5 years that I've been on the board money on equipment for that surgical suite that remains unused, which is not a good use of our resources. And then just the other comment I wanted to make was that we have a nice residence associated with the hospital, but well, it was nice a couple of decades ago. It's a little beat up and run down now, and it needs a bit of a facelift if it's going to be something that we're going to use to attract visiting nurses and doctors. So just those comments for your consideration, and thank you for your work.
Thanks. I actually wasn't aware of the OR suite that was available in Lillooet. So I know, things can be very different than what we're talking about in some of the surgical specialties where if we had more OR time, we could hire more surgeons into certain areas. So that's just good for something for me to know, just in case there's someone who's interested.
That's wonderful. And I know our mayor and council have been lobbying with Interior Health to try and provide more of that service. But I'm very glad if you didn't know that, that you know it now. It might be an opportunity. Great.
When I speak to some of the surgeons, Michael Ross, ophthalmology, Jason McVigar, and I think Jeff Poon, when they're traveling up to Williams Lake or Clearwater, they enjoy the hospitality, the golf. They really feel loved and they really come back excited. And of course, they continue to go back and do surgery in your communities. So good job, everybody. Thanks.
Thank you. We have Director Hall, then Director Roden to close. Director Hall.
Thank you. Thanks for the presentation. And Heidi, it's always great to see you. Your enthusiasm for the community support and what you do for the foundation is remarkable. The question I have is with regards to hospitalists. Can you tell the board here approximately in the last 3 years, how many GPs maybe have closed their business and turned into a hospitalist and how that impacts a community like Kamloops?
Interestingly, hospice is one of our pinch points right now. So we're not very well staffed with hospitalists. And, you know, as that longitudinal family practice model comes in, we're a little bit worried about maintaining and being able to hire hospitalists. So interestingly, in the past 2 or 3 years, since I've been more aware of these issues, I haven't seen much of that happening. I think that happened more like 5-10 years ago. So we haven't seen, I can think of one, but I might not be exactly, you know, correct, but it's not been a major theme in the last few years.
Did IH not change the recruitment that you couldn't be a doctor that was going to close their practice to take a hospitalist job? Or did I misunderstand? I thought that was something they said.
Like the example I'm thinking of was not someone with a like long-standing community member. It was someone who was doing some family medicine and some long-term care that has come in, and it's actually been really important for maintaining our hospitalist service, which is at risk.
Thank you. Director Roden.
Thank you. This is just in addition to what Director Birch Jones said about Lillooet. That was certainly a very well-used surgical option by residents of Ashcroft, Cache Creek, Clinton, Lytton. Again, we were able to use, and this is going back 6 or 8 years, what we now think of as virtual doctor technology to prep patients in. They would come to Ashcroft Hospital and have virtual meetings with the surgeon and the anesthetist in Lillooet to save them one of those trips over. So certainly we feel the lack of that surgical option in Lillooet and anything that could be done to get that back on track. We even do have a community bus that can be utilized between the communities to get people. We used it once before to get people to Lillooet to visit practice ready assessment doctors who were training in Lillooet and who were coming to Ashcroft. So we did it before, we can do it again.
Thank you for those comments, Director Roden, and thanks to both of you for attending and presented today. I think you probably got a little bit of feel of the room where we may want information next time when you come back, but I greatly appreciate it. Thank you. Okay. Thank you. Okay, for chair update, I don't have a lot today, other than I'd like to acknowledge that we are joined here today by Deputy CAO Vieira. CAO Hildebrand is not with us today, but I thought that was important to acknowledge that he is here on behalf of administration as the CAO. And I'd also like to just make mention for people that have been on the board previously, but also maybe some of the media watching, is we are not holding our inaugural meeting today for the chair of the hospital district. And historically, we have always done it on the same day as the actual chair of the TNRD. However, under new legislative services manager Lois found through records we operate under different legislation, and we shouldn't actually be having our inaugural meeting until the first meeting in January of the following year. So just again, for those people that are wondering why we're not doing it today, that was something that was found, that historically we've been doing it wrong for a very long time. So we are here to correct that. All right, thank you. I would like to move ahead to 6.2 and a report from External Relations and Advocacy Advisor Kelly.
Yeah, thank you, Chair. We wanted to bring back to the board following the approval to send out an RFP that was made on September 7th. We received 4 proposals that were actually spanning across the country. So from Halifax to Calgary to Vancouver. One had their head office is actually in Toronto, and they have a satellite office in Vancouver as well. So quite the wide range of proposals that we received. Staff's recommendation based on the criteria that you'll find at the back of the report is that we award the contract to Santis Health. They came in with the highest score of 86.6 out of 100 on the evaluation criteria. As stated on September 7th, the contract term is 10 months, and we are hoping to begin work on it on November 21st of 2023. The maximum amount is $75,000 as approved by the board, with a portion coming out of the remaining funds for the 2023 budget for the hospital district, and the remaining to be covered by budget 2024. So that's all I have, but I would be happy to answer any questions.
Moved by Director Bass, second by, oh, sorry, Director Laird. Thank you. Discussion. Thank you. All in favor? Opposed, if any? Thank you. That was great. We'll move on to 6.3, and there is a recommendation on the board for the 2024 meeting dates. Moved by Councillor Sarai, second by Director Thorpe. And I just want to comment on that. Notably, we've gone from historically 2 meetings scheduled a year to 4. This year, and while there will be some financial implications to that, what we are finding is that we are having a difficult time scheduling an extra meeting with this amount of directors, and it'll be easier to cancel the meeting if we want to than try and schedule an additional one. Also, as we look around interior health, we are one of the only ones that is only meeting 2 times a year. And so we're looking at changing that up. And I think for the future, we'll do this. And that being said, we also know that these dates may change, but we do want to put it out there that we're looking to have up to 4 meetings a year rather than a surprise meeting, throwing it in after 3 months. It's fair. It's easier for the board to plan and manage around our own schedules, as we're all very busy with our other elected jobs, but as well as in our personal lives. So that's why we have that on the table. So I'll call the vote on that. All in favor? Oh, sorry. Director Middleton.
I'm sorry, just a quick question first. So just in your preamble leading up to this, you indicated the election for board would be in January, except we haven't got a meeting in January. So is that March 21st meeting, which is proposed to be the first meeting out, is that within the time frame that's required of us? Thank you.
Manager Lewis.
Thank you, Chair. Through you to Director. The Hospital District Act requires that the board must elect a chair from among its directors at the first meeting held in each year. So in theory, if there was only a single meeting of the year and that was in December, that would technically meet those requirements. But yes, the March meeting, which is proposed, will be the inaugural meeting of this board.
Director Demare online.
Yeah, I'm just wondering if staff could send a calendar invite to hold those dates.
I see a lot of heads shaking around the table on the administrative side, so I think that will be coming. Thank you for that.
Thank you.
See no further comments. All in favor? Opposed, if any? Thank you. Okay. New business. Don't see. Director Stamer.
Thanks, Mr. Chair. Yeah, back to what I was talking about earlier about the OSEPIC shortages. I mean, I would like to see if there was support from the board to send a letter to our Minister of Health and find out an explanation of why this is happening. I mean, I know shortages is happening because there's a there's also a demand for this drug for a weight loss, whether it's, across the line or what's happening, but it's seriously impacting our residents because not only are they running short of the drug, but they're also finding difficulties getting another prescription because to use a replacement drug, as I mentioned, they have to get another prescription. It isn't something that can be seamlessly transferred by the pharmacist to be able to say, okay, well, now this is what we have on the shelf. And yes, it will be picked up by the insurance of our medical plan. I'm just wondering if we could, get support from the board to send a letter to the Minister of Health to find out why this is occurring. I mean, obviously, there's shortages. Why can't they change whatever they have to change so that our residents are not negatively impacted and not able to get that medication because of something that is nothing within their control?
Dr. Hayward.
I just want to reiterate, I just picked Ozempic up for my husband that he's been waiting a week for. We bought it from Costco and the deal was, yes, we have it here. You have to be here today to get it because tomorrow it goes back out on the market if you're not here. That's how hard it is to get. And for people dealing with diabetes, it's really serious because if they stop their Ozempic, then they have to start that program again later. And it is an amazing drug for people that are dealing with diabetes, kidney disease, things like that. And it's crying shame that it is going to weight loss unless the weight loss is a medical situation for that person. So we do need something in place. It's very important.
Thank you. So we don't have a motion on the floor yet, but I'm just wondering for Director Stamer, I'm wondering if we may get a quicker response back if we were to send a letter to IH asking for their thoughts on it, as opposed to going provincial and going through that long thing and being stuck.
I totally agree with you, Mr. Chair. If we think that that's the quickest way of doing it, I think that would be something that I would support, and I'd like to make that motion.
Moved by Director Stamer, second by Director Hayward. Any further comments? All in favor? Opposed, if any? Seeing none, thank you. Thank you for that, Director Stamer. All right, so just going over the next meeting, that the board directs staff to schedule an additional meeting for Friday, December 15th at 1:30 to review and adopt the 24-20, I'm sorry. Yeah, we're good. Provisional budget.
Are you looking for a motion?
Yes, please.
I'll make that motion.
Okay. Second by Councilor Director Newstater. All in favor? Opposed, if any? Oh, Director Getz.
Just a question, maybe I missed it. Did we vote on the dates?
Yes, we did.
Okay, thank you.
Thank you. All right, seeing nothing further, we'll go agenda item number 9, that we go into a closed meeting.
So moved.
Moved by Director Stamer, second by Director Sarai. All in favor? Opposed, if any? Seeing none, thank you. So just for staff, do we need the online people to re-log in on another Zoom link? Yeah, no, thank you. Just for clarification, the motion will be to move under 92B for the closed meeting. Okay. Thank you. Director Birch Jones, I see your real hand up, not just a yellow hand.
Just, and sorry for the noise in the background. I have a woodpecker bag. It sounds like I'm in a construction zone. We did receive a second link. Do we need to go out of this one and come back in on that other link now? I didn't hear the answer from staff.
Correct, we do need to do that. We just got verbal confirmation from staff on that.
Thank you.
They've got it.